Welcome to Champions of Care, brought to you by Oakwood Healthcare. My name is Mary Zatina, and today we're talking about sinus issues. If you've ever had trouble with your sinuses, you know how debilitating those problems can be. So we'll be talking today about that. This information is designed to equip you to live a healthy lifestyle, to make complicated medical information simple. And with me in the studio to help talk about sinuses is Dr. Bekker. You're a family practice physician with practices in Canton, is that right?
Correct.
So glad to have you here today.
Thanks.
So as a family practice physician, people are coming to you for all sorts of things. What are the kinds of issues that give you a hint, maybe there's a sinus problem here?
Well, usually they come into the office complaining of severe pressure in the face, pain around the eyes. Sometimes they can get some discolored drainage from their nose. Sometimes they'll have a fever, bad breath, occasional cough.
And those are the things that point you toward sinus trouble, perhaps?
Yes.
Dr. Bekker, can you tell us what is a sinus? Where are they? Are they in the nose, or what can you tell us and show us about sinuses?
Well, sinuses are cavities in the skull. We are not quite sure exactly why they're there, but the theory is that they're there to humidify and moisturize the air that you breathe in, or they're used to act as crush zones if you get a trauma to the face, or they're there to lighten the skull. Otherwise, your skull would be too heavy and your neck couldn't hold it up. There's some major sinuses in the head. The frontal sinus is towards the forehead here, and it's right on the top of the head. We've got the maxillary sinus that drains into the nose, and that's in the cheek area. You've got the ethmoid sinuses that are up back in the back part of the nose, and then you have the sphenoid sinuses.
Where are they?
They're more towards in the back of the head also.
Now, I've heard people say, oh, I have a terrible sinus headache. Is there something different about a sinus headache from your run-of-the-mill horrible headache?
Well, a typical sinus headache, they come in and they are clutching their face, or they're saying that they're having pain when they bend over, when they move their eyes. The typical other types of headache or tension headaches are usually in the back of the skull or in the temple areas, and they feel like a band or a cap around your head.
Now, I understand that in addition to being a family practice physician who knows a lot about a lot of things, you have a little experience of your own with sinus issues leading up to sinus surgery. What were the symptoms that you felt, if you don't mind my asking, that told you something was wrong?
Well, I'd had pressure in my head for years, had been on numerous antibiotics, had tried nasal rinses, antihistamines, and nothing was working. The pain was getting so great that I just couldn't take it anymore and had to go off and see the specialist.
And that's a big deal when a primary care physician knows he needs a specialist too.
Right.
And I know in this area, I grew up calling them ear, nose, and throat specialists, but there's a fancy name for specialists who deal with sinuses, isn't that correct?
Correct, otolaryngologist.
Otolaryngologist.
Mm-hmm.
We'll be talking with an Oakwood otolaryngologist in just a few minutes about sinus issues, including surgery, but I'd like to know, how do you feel after you've dealt with your sinus issues, and are you glad you addressed them?
Oh, definitely. I feel great. My head feels good. I have no problems. A little maintenance issue with having to do sinus flushes every so often, but 100% improvement from previously.
Well, we're so glad to hear that. Dr. Jerome Bekker, you're a practicing physician, family practice physician with offices in the Canton area. Thank you so much for helping us understand the basics of sinuses and for being here today on Champions of Care. And coming up in just a few minutes is an otolaryngologist to talk even more about sinuses and sinus issues.